In early 2020, the UK endured one of the worst waves of COVID anywhere in the world. Key failings around testing, a flawed pandemic plan, and lockdown all contributed. This is what we now recognise as the UK's pandemic. You can see two catastrophic waves of infection. And we only have this picture because of testing. Zoom into March 2020, and cases look like they were very low, because back then we were only testing in hospitals. Cases were, in fact, in the tens of thousands. It left a colossal blind spot and goes some way to explain why even our most senior politicians could shrug off emerging health advice.
I'm shaking hands continuously. I was at a hospital the other night where I think there were actually a few coronavirus patients, and I shook hands with everybody, you'll be pleased to know.
But one thing we could measure, even at the very beginning, was deaths from COVID. Look at March again. On the 9th, with 5 recorded deaths, science advisors were undecided on lockdown. Why? Well, the thinking was it would have to last for a year or more, and people wouldn't comply.
It's not just a matter of what you do, it is also a matter of when you do it. Because anything we do, we've got to be able to sustain.
But by March 13th, deaths had tripled. Modelling studies were starting to show mortality could reach hundreds of thousands, but still no lockdown. Could the idea of herd immunity have played a role? The idea described by MPs as fatalistic, that the wave of infection would only end when the majority were infected.
We think that this virus is likely to be one that comes back year on year, become like a seasonal virus, and communities will become immune to it. And that's going to be an important part of controlling this longer term.
60%?
60% is the sort of figure you need to get herd immunity.
In the next 5 days, deaths more than quadrupled. The modelling data was nothing short of terrifying, but still no lockdown. So what happened? Well, a wake-up call from Italy. Sky News witnessed intensive care units in the city of Bergamo overwhelmed by COVID. Italy's outbreak only a week or two ahead of ours. Seeing was finally believing, and the UK went into lockdown 4 days later. A decisive step, but one that came weeks too late for tens of thousands of people that died in the UK's first wave.